Can there be any complications during the knee replacement surgery? Yes, there can be complications during the knee replacement surgery. What kind of complications, how we can avoid them, and if they happen, how do we manage them? We'll talk about all these things in detail today. So let's talk about the complications that can actually happen. There are two types of complications which can happen during the surgery itself. Number one are the anesthesia related complications, and number two, the surgical procedure related complications. If we talk about anesthesia related complications, most of the patients are operated under regional anesthesia. In this, an injection is given in the lower back which numbs the area below waist. So when a surgeon is putting a skin incision, is doing the surgery, the patient does not feel any pain happening to them. However, being a procedure, spinal anesthesia has been mastered over decades by the anesthetist and has almost become complication free, but still certain complications like dural injury, nerve injury can happen, although we have not seen them yet in our own practice. And if they do happen, the anesthesia team is well equipped, well specialized, well skilled to manage these complications at the moment, preventing any kind of adverse event which can have any long-term complications for the patient. Now coming to the surgical part, from the surgeon's end, the only complication that we are worried about is excessive bleeding. However, to prevent that complication, we use tourniquets which temporarily shut down the blood flow towards the operated limb, which results in negligible blood loss during the knee replacement surgery itself. Now, one more important thing for the knee replacement surgery itself. We use cement to glue the bone to the implant, and this cement has sometimes caused complications in certain patients in which certain lung issues, especially breathing issues, do develop. This is actually very rare, and if it happens, can be managed very diligently with the use of advanced medicines, fluids, and breathing support, including ventilator setup. Overall complication rate during the knee replacement surgery is less than 0.1% in majority of the cases. And if they do happen, they normally happen because of the poor expertise of the doctors who are doing it or the poor technology that they are being used. With the decision to choose the right doctor for your knee replacement surgery, who is using the right technology, doing it in the right setup with all kinds of backup, the complications during the surgery itself are extremely rare and rarely cause any long-term implications for the patient or their family. And this is the reason why most of the patients start standing and walking within 6 to 8 hours after the knee replacement procedure itself.